She's excited and happy about the results, and I can see why. So let's continue on here. You've got lung adenocarcinoma and melanoma. In a study, researchers found that a carefully controlled form of near-infrared light delivered with cooling to prevent heat damage was able to harm and kill certain lung cancer and melanoma cells in a lab and mouse experiments. The near-infrared treatment caused cancer cells to activate their internal DNA damage alarm systems, leading to many of the cells to stop dividing and undergo a natural self-destruction process called apoptosis. Fewer cancer cells were able to enter mitosis, meaning tumor growth, slowed. In mice, this light treatment reduced tumor growth in a way comparable to conventional drugs, but with less apparent discomfort. This represents red light therapy as a novel approach to cancer treatment. These results indicate that near-infrared irradiation, which is interesting that that word is used because we typically associate it with something that's harmful, can non-thermally induce cytocidal effects in cancer cells as a result of activation of the DNA damage response pathway. The near-infrared, one of those enzymes is caspase-3, which is a death enzyme that's activated through light therapy. The near-infrared irradiation schedule used here reduces discomfort and side effects. Therefore, this strategy may have potential application in the treatment of cancer. And here's a clinical study here. Lung cancer. In a study review, researchers describe PDT, photodynamic therapy, as a promising and highly targeted light-based treatment for lung cancer that can meaningfully improve both outcomes and day-to-day symptoms for the right patients. PDT uses a light-sensitive drug that collects in tumor tissue and then activated with visible light, reducing cancer-killing oxygen molecules that can destroy cancer cells that damage the tumor's blood supply and help trigger anti-tumor immune responses. Across clinical studies discussed, PDT was highlighted as especially valuable for people with inoperable lung cancer or tumors blocking the central airways, where it can reopen airways, ease breathing, reduce symptoms quickly, and improve quality of life, and in some cases, prolong survival. The review also emphasizes practical advantages. PDT is minimally invasive, can often be done via bronchoscope, is repeatable, tends to have fewer whole body side effects than chemotherapy or radiotherapy, and can be used alongside other treatments as part of a multimodal plan. Overall, the paper presents PDT as an underutilized and underused but clinically effective option that could benefit more lung cancer patients when applied with the right photosensitizer, light delivery, and patient selection. Here's the clinical study backing this finding here. Esophageal cancer. In a study, doctors reported that PDT can be a helpful, minimally invasive way to improve quality of life for advanced esophageal cancer causing blockage or bleeding. PDT is done through endoscope. Patients receive a light-sensitive drug first, then a special light is applied inside the esophagus to shrink and destroy tumor tissue, helping to reopen the swallowing passage. The encouraging finding was that PDT improved swallowing in the large majority of obstruction treatments, and the average period of easier swallowing lasted about 2 months, 66 days, often enough time to make eating and drinking more comfortable. Some patients were able to stop supplemental feeding afterward, showing meaningful functional improvement. PDT was described as an effective palliative option, particularly for tumors that grow inside the esophagus, and it was commonly used as part of a multimodal approach to keep symptoms controlled. So here's the clinical finding here: 215 patients, 318 courses of PDT, which isn't many, right? And that's not per person. That was, well, actually, it may have been. I'm going through this right now. Well, going through this in detail with my analysis for you guys live here. You could read it all yourself there. 4 months. PDT offers effective palliation for patients with obstructing EC in 85% of treatment courses. It's a very impressive modality here, and show to be extremely effective here. Liver cancer. This study suggests that red light therapy may help slow liver cancer cell growth and reduce hepatitis B activity at the cellular level. Liver cancer cells rely heavily on damaged mitochondria, their energy centers, especially in people with chronic hepatitis B, which creates ongoing oxidative stress. When red light 650 nanometers was applied at specific low doses in the lab, it disrupted these cancer cells' energy systems, leading to reduced cell growth, lower survival, and signs of cell breakdown, while also reducing the release of hepatitis B viral particles linked to disease progression. In simple terms, the red light appeared to interfere with how liver cancer cells make energy and replicate, nudging them towards shutdown rather than growth. While this is an early stage laboratory research, the findings are encouraging and support red light therapy as a potential complementary approach worth further study alongside standard liver cancer and hep B care. Here we've got the clinical finding there from the research. Red light and apoptosis in pancreatic cancer. Here you see that PBM, near infrared light, shows that it's addressing cancer of the pancreas by directly affecting how cancer cells function and survive. In a lab study, specific doses of near-infrared light triggered pancreatic cancer cells to activate their internal self-destruct system, apoptosis, switching on key death signals and causing damage that their cancer cells were unable to repair. I love that, right? This effect was not due to heating, but rather the light interacting with the cell's energy systems and DNA damage pathways, which cancer cells are particularly sensitive to. The important part here is the response depended on the light dose and exposure time. So the light dose was important. If it was not enough, then it's not adequate. Exposure time, how long were you on that? And then the next part of that is how long is that treatment for? Suggesting the treatment can be carefully tuned. This is encouraging because it highlights red and near-infrared light as non-invasive targeted approaches that may help slow pancreatic cancer cell growth and weaken tumor survival mechanisms, supporting future therapeutic strategies as research continues. And there's the clinical finding here. See here you see the caspase-3 in the keywords, which is the death enzyme. It's fascinating. They're using near-infrared at 9:15. Okay. And by the way, 850, 1064 would be examples of being close to the 900s, and it's going on either side and both sides of that, which arguably make that potentially a more effective treatment because you're hitting more, right? 810, 830, 850, 1064, 1060. You're hitting these key wavelengths all simultaneously so that you're getting shallower and deeper so that you're interfacing with all the key areas. So sometimes in the studies, they could be improved upon, and that's kind of one of the things that you can get by assessing all of them. Then you have stronger abilities to be able to give powerful reflections. Bladder cancer. In a review of many laboratory, animal, and human studies, researchers found that red and near-infrared light therapy, also called PBM, shows promising supportive effects for bladder and urogenital conditions. When it comes to bladder cancer, animal studies showed that this type of light therapy could help prevent cancer development by reducing harmful oxidative stress and supporting healthier cell function in bladder tissue. Rather than directly killing cancer cells, the light appears to work by improving the cellular environment, helping cells manage stress, repair damaged cells, and maintain normal function, which may make tissues more resilient and less favorable for cancer growth. The overall findings suggest that red light therapy may play a supportive or protective role in bladder health. Love that, protective. Okay, and that's the thing that is relevant to everyone. I'm grateful that I don't have cancer right now. If I did, then I'm grateful that I have solutions. And if you're in either camp, there's knowledge to be gained because we're looking at supportive and protective. Protective being preventative. PBMT was found to prevent bladder cancer development. Look at that. And improve renal oxidative stress markers in diabetic rats. Okay, so disclaimer, this is in diabetic rats, but it's giving us a key tool here, one of which that's hard to even talk about because most studies are going to go into the let's say, the sexy part of what clinical studies do, which is to come and aid with a problem that exists because there's a market for it, and therefore there's clinics that are going to need that, but it's not as sexy, sorry for the informal language, to be conducting studies that are all built around prevention. But this is a great tool to give us a key that if this was then preventative in these animals for this certain type of cancer, then what does that mean? Is this a general, does this give us a key that exists as a general reality? Or is this simply a centralized issue that only relates to that one particular issue? Okay. PBMT was found to prevent bladder cancer. I love that, directly from the study. Bladder cancer development and improve renal oxidative stress markers in diabetic rats. Okay, colorectal cancer. This paper suggests that LLLT, low-level light therapy, or red light laser wavelengths, may help against colorectal cancer by selectively slowing the growth of cancer cells, while largely leaving normal intestinal cells unharmed. In the lab, the light treatment appeared to disrupt the cancer cells' energy system, their power supply, reduce survival signals, and trigger the cells buildup in their and trigger the cell's built-in self-destruct process, apoptosis. It also switched down a major cancer growth signaling pathway called WNT and activated immune-related death signals involving TNF-alpha and caspase enzymes that further encourage cancer cells to die. Overall, the authors argue this kind of red light therapy could potentially be a gentler, targeted approach to help inhibit tumor growth, though the study was done in cells in a lab, not in human patients. LLLI successfully achieves tumor cell normalization while delivering a potent anti-cancer effect, expected to be a novel therapeutic modality for CRC. Here you see it directly here, which is colorectal cancer. Okay. Heather says, my husband had a growth on his bladder. It's been removed and waiting on biopsy results. We're using the red light therapy belt over that area. And I'm glad to hear that. Lena, great. Okay, absolutely. We'll get your team, my team, sorry, to interact with you there and make sure you're taken care of. And I'll also, as we go, I'll show you guys how to get going on all of that. So bone cancer, which includes primary and metastatic forms, poses significant treatment challenges impacting the quality of life for many patients. Conventional treatments such as surgical resection, radiotherapy, and chemotherapy often fall short, as some cancer cells may remain after surgery, and certain tumors can be resistant to other therapies. This review, Progress of Phototherapy Applications in the Treatment of Bone Cancer, highlights recent advancements in phototherapy for bone cancer treatment, emphasizing its effectiveness, especially in using photosensitizers such as methylene blue and chlorophyll. Conclusion: phototherapy is emerging as an effective treatment for bone cancer, primarily utilizing near-infrared light for its deep tissue penetration with minimal side effects. It can generate reactive oxygen species through photodynamic therapy. So this is the key mechanism. And you can see here it can induce photothermal conversion, leading to tumoricidal effects, okay, the death of the tumor. Lymphoma. Red light-based photodynamic therapy is an encouraging, gentle treatment option for cutaneous lymphoma that affects the skin. In this approach, a light-sensitive cream is first applied to the lymphoma spots where cancerous lymph cells absorb it more than healthy skin. When red light is then applied, it activates the cream and then creates a burst of energy inside those abnormal cells, leading them to shut down and die while largely sparing surrounding tissues. Studies show that this can significantly reduce or clear early localized lymphoma patches and plaques, often with fewer side effects, minimal scarring, and good cosmetic results compared with surgery or radiation. While it's mainly used for early or limited skin lesions, it's still being refined. The research is reassuring. Red light-based therapy is non-invasive, repeatable if lesions return, and generally well-tolerated, making it a hopeful complementary option under specialist care. Here's the clinical research here for this cutaneous lymphoma. You'll see under figure 1, it says a complete response in the patient with this certain type of lymphoma with 2 sessions of MAL PDT, which is aminoleuvolinic acid, but it's a methyl form, and one that maybe is not so easy to get as a layperson, but it also could be argued that methylene blue is superior, and you'll find that actually surprisingly by using like the AI ChatGPT tools to aggregate all the studies on all the photosensitizers used, and you'll find that methylene blue does score the highest as being the single greatest photosensitizer that exists, which is super cool because it's so cheap, like 30, 40 bucks a bottle, and enough to kind of potentially be there for all the treatment needs. That's awesome. Yes, it is impressive. What I'll tell you about this study, okay, guys, here's what's impressive about this study is that there were 3 people in the study, and I'm going to show you this. I'm going to share screen. 3 patients, CBCL, red light, complete remission. I'm going to share screen and show you this extended study. Red light therapy with skin cancer. Study tested. Okay, now let's think about it. Okay, so if red light's so good, then there's got to be some things it's not good for. Okay, fair enough. Maybe you're right. Maybe there's some things it's not good for. Okay, maybe not. Let's see. Okay, I'm going to change up. All right, sorry. I'm just interfacing with my team here because I got to make sure that everything's working, because that's what you do when you're doing an event. So cool that we can do events like this, right? Awesome. Okay, so this would be an example where if you think about the fact that, okay, well, red light might not work for lupus, rosacea, skin cancer, epilepsy. Why? Because these are all things that, for example, sunlight could be detrimental for. Say your skin cancer, you don't want to tell someone with skin cancer, go out in the sun all day. What if it makes it grow? Okay, now epilepsy. Well, light, you get exposed to light and have a seizure. Okay, seizures. Okay, so now then you come into rosacea. Yes, exposure to light, issue. Lupus, exposure to light, issue. Okay, now what if I showed you studies on all of these that were showing that it was extremely effective? Okay, so Melinda says someone needs to be preaching this from the mountaintops. We've been lied to for decades. So true. Yes, how much research has been done on dosage guidelines for the various treatments? They are all in the studies. And one of the things I could teach you as well, because there's 75,000 different conditions that are now in existence, then I give a man a fish, teach him to fish 2 different scenarios. One, you have food for a day. The other one, you have food for a lifetime. So I'm going to show you how to work out exactly what that study did. And so then one, you can replicate it as a baseline, but then I'm going to give a parameter by which that if you look at nature, there is one way and only one way that nature shows you to do this, which is red light every day. Because why? There's red light every day. And when? At sunrise and sunset. So now you have the 2 times in the day, if you could, right? Most of the studies you just saw didn't even assess that. But in terms of this is why I tell people to think biologically, nature, from the earth and world around us and everything that we can observe. Look at the fact that we clearly see we don't just see very few, if any, cancer cases in animals in the wild, but we also see thriving health. And sure, we could see some cases. Yeah, there are some cases where animals are having health issues. Just think about the ratio of how much animals in the wild are having health issues in comparison. And then the things that when you see the images or something like that, these are often very old animals that's their last kind of moments, like lions, or you see them, they have fairly low life expectancies in comparison. And so that, yeah, I'm not talking about immortality here. That's another conversation, but yes, where then see that nature then tells us that you are biologically designed for red light twice a day, which would be translating simply 15 minutes twice a day. Easy. That's done. That's everyone. Now, in terms of this clinical study showing 64 to 84 minute long sessions with long COVID, and that may not be relevant to a lot of people because they say, well, long COVID is not my issue. But what if everything is very much a similar type of issue? And in this case, when you have an acute issue, we do have a case there for doing hour to almost an hour and a half long sessions for a period of time. In that case, 4 sessions were conducted and there was a complete remission of everyone, of resolution of all symptoms, which were all oxygen related issues, dyspnea, shortness of breath, low oxygen in the blood. Everyone then had oxygen above 97%. This is not exaggeration. This is the European Society of Medicine. I can show the study, but this is examples. So there's not one, a one size fits all, even though in some ways there is, but you do have to kind of listen to your body. And then you have each of these studies. When we send out the replay, which everyone will get the replay, you can then put the keywords in of every study. Just when I say the keywords, any words basically from the study will give you the study, especially the title, will generally give you the exact study that we found. And then you could easily then put that study. If you could not be bothered reading that thing, then all you need to do is grab that and then put that into Google. And literally in Google, you could say, here's the study, show me how they did this. And better yet, ChatGPT, grok.com, any other AI, Manus, whatever AI tool you might be using. Oh, Jonathan, I've never used an AI tool. That's fine. Go to chatgpt.com, put the study in, use it for the first time right now during the call. And then ask the question you want to ask me there, and then ask me a better question. And we're going to go through questions here shortly. We're almost in the question section here. Safety of red light with cancer. So there's 300 tumors. They were tracked for over a month. They found no evidence, second paragraph there, that red light made the cancers grow. In fact, the treated mice sometimes looked healthier with better skin quality and more normal behavior. The results suggest that at safe treatment levels, red light therapy does not promote tumor growth, and light therapies may even support overall well-being, meaning it could be safe to use in cancer patients for tissues for issues like wound healing or lymphedema. Amazing. Okay. All right. Let's continue. There's the clinical study. Here's the cancer protocol. This is an example. Okay. This is not diagnosis, not even advice, medical advice. This is just an example of what emerged from a lot of the cancer studies. And so here you see the wavelength, 630. This is 660. And then near infrared, 810, 850. Time, keep it brief, targeted for about 10 to 20 minutes. If it's over all the organs, like a panel that's behind me, 3 inches away. Use PBM supportively 3 to 5 times per week for cancer. It's important to note that if using red light over a direct wound, start slowly and monitor your comfort levels. Treatment area, apply the red light device over the affected area for best results. Ensure that you follow the manufacturer's recommendations for the distance away from the body. And typically, look, you can actually have your body directly against it. I would say arguably in almost all cases. And then that being said, typically like 3 inches away, the heat of the device itself, then you're now in a thermal therapy and you're heating. And hey, guys, Daddy's got to stay in here, okay? No, it's all right. You can clean it later. Don't worry, I'll clean it, okay? Yeah, but you can't now because Daddy's got to work, okay? Thank you, Arthur. All right, now the door's locked. Poor guys. Okay, so you could be close. You can be 3 inches away, and even eyes open if the red is out, if the blue is out, and then it is strong, but it doesn't hurt the eyes, and it really energizes and revitalizes the body. I believe that direct into the eyes is one of the most overlooked treatments because of how it regulates everything in the body. And which is why the UCL University, when studying red light over the eyes, it was on average a 17% improvement in eyesight immediately within the same 24-hour period. Okay, now in terms of stacking that, it's going to get better than 17% over the course of several days and weeks, and hence why we're seeing the most radical transformations in eyesight in short periods of time. But more important than eyesight is part of seeing brain improvement, because eyes are part of the brain. So by getting the light into the eyes, you're getting it directly into the brain. By getting into the brain, you're stimulating and causing the ability to be able to improve your vision and improve your brain function. So this is really profound. So let's check this out here.
In Russia, where the restrictions on medical practice are very few, ironically, and also in Japan and China, you see photodynamic therapy being used for cancers in a way that I think is really probably the most intelligent way to treat cancer. Instead of just cutting it out or trying to obliterate it, smash it to smithereens, they are very slowly reducing the size of the mass through the light treatment. So the person will come in for consecutive light treatments to try to get the tumor shrunk down. The benefit of that is that you are harnessing the immune system each time. So you're training the immune system to go after that cancer, and you're avoiding things like tumor toxicities that result from the breakdown of the tumor lysis syndrome, and other things that can pose a real stress on the body for the cancer patient. So this is a very important paradigm shift, to think about reducing the size of the tumor over time, and then to also think of using a treatment that not only gets rid of the macroscopic side of the tumor, but activates the whole immune system to go after any residual cancer or any cancer that is distal to the primary tumor zone. So that's really the beauty of the photodynamic approach in combination with these other treatments.
All right, awesome. That's Dr. Mark Nathaniel Mead. He's got some great content there. So what is PDT? It's a treatment that utilizes a photosensitizing agent to treat various medical conditions, including cancer. Here's how it works. Photosensitizing agent is applied. It selectively accumulates in target cells or tissues, or it certainly does to the capacity where it is then causing a strong reaction, like a negative reaction to the cancer cells, and which is a positive reaction for you that doesn't want those, and a positive reaction to healthy cells, and hence why it appears that it's only accumulating there, but it's being absorbed by, generally speaking, all of your cells. It's activated by specific wavelengths. So, for example, methylene blue is activated by 660 nanometer red light, and most are activated by 660, 670, and anything that's activated by 630 or 670, it's 660 is going to be working. Interestingly enough, curcumin is primarily activated by 450, 480 blue light, and then secondarily activated by red light at 660. And so these are, then make it important that those are there. The ones that are activated near infrared light include, other photosensitizers like indocyanine green. It's not very commonly used or known. Hard to get a hold of, very expensive. Probably not just really part of a protocol. And I am looking to see how we can maybe make that available to people. It's more of a kind of global movement type thing in terms of making that so it's an accessible therapy to all. But that's activated near infrared. But the activation of the methylene blue is showing that it is helpful for cancers related to bone and lungs and deeper areas. So the near infrared is still benefiting the treatment and the application of the methylene blue. So when activated by light, the photosensitizer generates reactive oxygen species such as singlet oxygen and free radicals. So singlet oxygen has been used in military settings to blow up missiles. So it's not commonly used, but it has been used. And so it can do this, right? Whereas your body is naturally producing it. And they singlet oxygen and other reactive oxygen species are highly reactive and cause damage to nearby cells and tissues, leading to cell death or destruction of targeted tissues. It's used to treat various conditions, including cancer, skin cancer, lung cancer, esophageal cancer, non-cancerous conditions, acne, actinic keratosis, macular degeneration. Its application depends on the ability to selectively target and activate the photosensitizer in the affected area. So here's popular photosensitizers: chlorophyll, curcumin, riboflavin, methylene blue, artemisinin, berberine, green tea. There are some examples. Okay. Curcumin is a photosensitizer. It's derived from turmeric, exhibits diverse medicinal properties, including antibacterial, anti-inflammatory, antioxidant, and anti-cancer effects. Its anti-cancer activity is primarily attributed to its modulation of cellular signaling pathways. Red light therapy enhances curcumin's efficacy by influencing apoptosis pathways and affecting cell cycle regulation. Conclusion: combining curcumin with photodynamic therapy shows promise in overcoming these limitations by enhancing its anti-cancer efficacy, by inducing cancer cell apoptosis, and improving curcumin's bioavailability. That's the clinical study on this finding here. Berberine, it's a natural plant compound. It can enhance the effects of photodynamic therapy. On its own, berberine is safe and only slightly affects cells, but when combined with light, it acts as a photosensitizer, a helper that makes cells more sensitive to light. Once berberine-filled cancer cells were exposed to blue light, they produced a burst of reactive oxygen species, which is amazing considering that blue light is not in most devices. We put it in our device for a reason. It's because of all this amazing research that we have that allow you to have a versatility to what you're doing, which damaged the cancer cells and triggered them to self-destruct through apoptosis, a clean programmed form of cell death. In cervical cancer cells, this combination drastically reduced survival compared to light or berberine alone. In simple terms, berberine helps supercharge light therapy, making it more effective at killing cancer cells while being safe for normal cells. Here's a clinical study here. Infrared sauna benefits. Okay, so now we're moving over to sauna. I talked about some of the benefits of sauna. Now here we're going to see this. Detoxification. This is done by increasing the body's temperature, which helps stimulate sweat glands and eliminate heavy metals, pesticides, and environmental toxins through the skin. Improves circulation, increases blood flow, and improves circulation, helping oxygenate tissues, remove metabolic waste, and support recovery. Pain relief. Infrared heat penetrates muscles and joints deeply, helping reduce inflammation and relax tense areas. Weight loss support by increasing heart rate and body temperature. Your body works harder to cool itself down, mimicking the effects of physical activity and potentially aiding in fat loss. Stress reduction promotes deep relaxation by balancing cortisol levels and encouraging the release of endorphins and serotonin. Skin health improves skin tone, texture, and clarity. Enhanced circulation also delivers more nutrients to the skin, potentially reducing the appearance of acne, eczema, and signs of aging. Here's the benefits of sauna exposure. Sauna therapy has been a cornerstone of wellness in Scandinavian cultures for centuries. Today, research supports its use for a wide range of health conditions, including high blood pressure, heart failure, and recovery after heart attacks. People living with chronic... Look, I can't stop reading this without thinking about my granddad, who I never got to know other than the interactions that we were able to have when I was one, when he died of a heart attack at, I believe, 62 years of age. And like, I'd read every word of this just thinking I could have helped solve that problem. It's not me, it's God, but I know what to do. And I could have helped him solve the high blood pressure issue. And I have the tools. I could have helped him just like I helped my grandma, who's gone back to, on my wife's side, Abuela. She's now fully mobile. Did I mention that before? I just do so many talks. I can't remember if it was a previous conversation. I think I did, right? So she's gone back to being fully mobile because of just this red light panel behind me, like this, like RL Pro 200, right? So like a $1,200 device has got her back. By the way, we had somebody just reach out. I was on a show and he's like, this was the same feeling I got when I got my first iPhone, with looking at going from a plastic phone to a like hardcore metal phone, and the quality was that of like an iPhone. I was like, thank you, man. That's really kind. And Mike Adams said that is the highest quality thing he'd ever seen. So it was really nice. Anyway, my point there is a $1,200 device enabled her to be able to get back her life and mobility. And my granddad, with, for example, I'm about to show you, maybe it won't be in this slide, maybe it will, but it was a 63% reduction in risk of sudden cardiac death because of sauna exposure, regular sauna exposure. And so this is one tool that I would have put him on, and he was always ready to do the next thing and was doing some things that I've only learned about in recent times, and he was way ahead of his time. And so he would have gladly done all of those things. And I just feel so sad because I know the damage that that had on his wife, my grandmother, my father, and his two daughters, my aunts, that kind of almost always lived with a trauma since then of kind of witnessing the heart attack and not being able to stop it, and then missing him and feeling like, why God, why did you let this happen? And so like all these things like just mean that we have a time to act now with our loved ones. Let's get to work. Let's do something while we can, because you can't in the future. And then you have the memory of them, and no, you should not take accountability or feel like it's your fault or anything like that. Just if you have the opportunity, then why not do more? Why can't we all be taking care of all our loved ones to the best of our ability and be working for these things? Okay, so people living with chronic conditions such and such. Saunas also play a key role in detox and cleansing protocols, especially for those affected by environmental toxins. Many cardiovascular studies use far-infrared saunas. Detox-focused research trends tends to rely on radiant heat units. The good news, both types, far-infrared and radiant heat, are both considered safe and offer powerful natural support for your overall health. It is more about the heat therapy, but far-infrared still taps into the infrared benefits. So hence what we use far-infrared heat therapy.
With you, Jonathan, finding out about infrared sauna, I went and started that 6 weeks ago, and that has just been an incredible tool into all the other things that I have put in place. The infrared sauna, for my memory, mainly the first time I felt the sweat coming out of my head and releasing out of my brain, it just felt so clear and felt so good. After the first infrared sauna and released all the inflammation off my brain, I went to go and read our power meter. I looked at the numbers. I wrote them down straight away. I came back over. I texted them and I remembered them. It was just incredible. It was just amazing to feel the difference from 3 years of struggling to write down some numbers, to be able to look at those numbers and just nail them first off. It was, it was a breakthrough, I feel, for me after 30 odd years with inflammation and battling with memory. To just remember those numbers was incredible. My energy has soared. You know, I used to have to rest all the time with my brain injury. I'd have to really schedule my days to be able to do my work, get done on the property what had to be done, and all the time having to go and rest my brain. With the infrared sauna and the protocols that Jonathan's been able to share with us and implementing them into my own life, my energy's just been increasing. I've been getting glimmers of, that's how I used to be. That's how I was in my younger days. It's just amazing to feel that the surge of energy coming back. My life feels like it's coming back. And especially in the last 6 weeks with the infrared sauna, the change in my body has been
That's awesome. Who loves her accent? I love her accent. Who can guess where that accent is from? Okay, so I'll let people guess. Okay, so the change in my life. Okay, it's beautiful. So that was a transformation on a product that we got to her that cost her like roughly $600. Okay. That is mind blowing. If you paid $600 for a treatment and it did that for you, it would be worth it, even if it's kind of all you had. If it had some lasting impact, even if it only lasted maybe, let's imagine hypothetically lasted 6 months, it'd be worth it. And then you just going to get by so that you could then go and do that again, because like without her ability to remember things, and her quality of life and her ability to make a living and take care of her needs then goes down. So then it becomes essential that she then takes care of her needs. So amazing that such a inexpensive, extremely effective tool then worked so powerfully for her, and that's with sauna. Okay, so PEMF and oncology. Pulse electromagnetic field uses gentle, low-frequency electromagnetic signals to influence how cells function without heat, pain, or damage to healthy tissue. Research in lab studies and animal models show that PEMF can slow cancer cell growth, disrupt cancer cell division, reduce blood supply to tumors, and trigger cancer cells to self-destruct, apoptosis, while largely sparing normal cells. PEMF appears to interfere with the scaffolding cancer cells need to divide, stress their internal systems, and alter signals that tumors use to grow new blood vessels. In animal studies, PEMF exposure led to smaller tumors, reduced tumor blood flow, and even complete tumor regression in some melanoma models without harming surrounding tissue. Early human studies suggest PEMF is safe, well tolerated, and may help stabilize disease in certain advanced cancers. PEMF is considered a promising non-invasive supportive therapy that may help weaken cancer growth mechanisms and improve quality of life when used under appropriate guidance. Okay, so now we're tackling this from each angle, and we're using heat therapy, we're using red light, we're using pulsed electromagnetic field therapy. And they're all doing different things, but they're all supporting healthy cell function, and they're all helping and proven through clinical studies to have a beneficial effect on cancer, right? So here, check this out from Dr. Daniel Newsom.
Injured or inflamed or toxic cells depolarize, all right? Their voltage drops down to 20 to 40, negative 20, negative 40, right? Depolarized cells don't absorb nutrients, don't expel waste. They heal very slowly, if at all, and they signal pain and inflammation. That stinks, right? So PEMF helps to repolarize these cells. You can basically recharge their battery, if that makes sense. Okay. So here's some mechanisms, core mechanisms here. Number one, PEMF restores cell membrane potential. Okay. So this PEMF influences my dog. I have a pit bull. She is laying on my feet here, and she wants me to pick her up. She keeps putting her paw on my knee. Not right now. Just a minute. Before I had this dog, and my daughter had her little dachshund, I wasn't much of a pet guy, right? And I make fun of myself all the time now, because I have my like they say in Native American medicine, I have my two-legged children, and I have my four-legged children. And this one is my baby. Oh my goodness. And the family just makes fun of me now, because I'm totally a pet papa now, you know. It's so funny.
How many pets?
So funny. We only have 4 at the moment.
You buy them.
Right. You know, so our joke in the house is that we have pit bulls and we have dachshunds. It's the dachshunds tell us there's a problem, and the pit bulls take care of it for us. That's our joke. So,
and pit bulls are scared of the dachshunds.
So they are. It's so funny. The dachshunds run the show. It's so funny. You know, the pit bull, their mouth, they could fit the dachshund in their mouth, literally. And the dachshund, oh no, they've got those pit bulls trained. It's funny. Sorry, let me get back to our subject here. But, okay, so PEMF influences ion channels in the body. Okay. And so these are things like sodium, potassium, calcium, magnesium. Okay. and it helps cells regain their voltage. And so it's how it has this effect on these minerals in our body. That's how it regulates the pH in the system. Okay. And when the pH regulates, the voltage regulates. It's really pretty cool. So your cells are like rechargeable batteries. Okay. Trauma, toxins, stress, inflammation all drain the battery.
Mile away there. There you go. That's pretty impressive, right? So you're understanding more of the mechanisms, what you're doing, why you're doing it. These become critical aspects of what, how we do things. Okay. So PMF for prostate cancer. So we looked at red light for prostate cancer. Now we'll look at PMF, and these studies are both done in isolation. And then I'll show you some combination therapies, and then we're kind of like done. I'm going to share with you some ways that you can get red light in your home, which arguably is the most important part, because information knowledge is great, but applied knowledge is how you get results. And otherwise you've just got knowledge. And at that point, the information can be a bit of a curse, because if you know, but then you don't have any of the benefits that are attached to that knowledge, you just have knowledge. And so you know what's going on in your body. You know what could happen if you had certain things, then that's becomes a very sad and lonely and upsetting kind of thing. And with red light, it can be as simple as like I mentioned, like a red light belt as an example, or it could be a full body panel, or it could be a full suite. That's really up to you, but these are then become powerful tools. So I'm going to show you that, and then we're going to go into questions. And so we don't have much longer here, which is great. Well, kind of, because I mean, like, how good is this, right? So anyway, research studies how PEMF could support prostate cancer treatment, especially when combined with microwave ablation, a medical technique that uses heat to destroy cancer cells. They tested prostate cancer cells in the lab using different setups. Some only got microwaves, some only got PEMF, and some got both. The combination of PEMF and microwave therapy was found to be more effective at stopping cancer cells from spreading and made them more likely to die off. Even when used alone, PEMF slowed the ability of cancer cells to move, which could help reduce the risk of cancer cell spreading to other parts of the body. In simple terms, this study suggests that PEMF may help weaken cancer cells and make treatments more effective, showing promise as a supportive, non-invasive therapy for prostate cancer, though more research still needed to confirm its benefits in patients. Here's the clinical finding here. Okay, study on PEMF for cancer. This is specifically breast cancer. PEMF is being explored as a gentle, non-invasive cancer treatment, especially targeting cancer cells while leaving healthy cells unharmed. Researchers found that when breast cancer cells were exposed to low-frequency PEMF, it slowed their growth, triggered cell death, and pushed them into a state called cell senescence, where cells stop multiplying but don't die right away. Remarkably, normal, healthy cells weren't just unaffected. They actually showed signs of improved health and increased growth. This suggests that PEMF is a research approach being explored for its selective effects on cancer cells by weakening cancer cells without harming surrounding tissue. PEMF study continued. When combined with senolytic drugs, which help clear out those lingering senescent cancer cells, this approach could become an effective two-step strategy for eliminating tumors with fewer side effects. This was confirmed in results showing that PEMF-treated cancer cells underwent both cell death and senescence, while normal fibroblasts remained unharmed and even showed signs of increased viability. PEMF-treated cancer cells not only displayed cell death, but also senescence. In contrast, normal fibroblasts were not affected by the possible harmful effects of PEMF, but increased their cellular viability. Senescence acts as the body's natural defense against cancer by stopping damaged cells from dividing, essentially putting the brakes on potential tumor growth. And here's the clinical study backing this finding here. Now, here's a magnetic field study. This study explored the effects of high-intensity PEMF using magnetic fields from up to 150 millitesla. So two groups, 150 millitesla and 80 millitesla. And human stem cells were put in this environment, and there were no signs of toxicity or negative effects in the cells. And both treated groups continued to grow and thrive over time. And the 150 millitesla group showed a clear trend towards higher expression of key healing factors like collagen, VEGF, which is vascular endothelial growth factor, and bone building proteins. VEGF in particular helps create new blood vessels, essential for tissue repair and recovery. The findings suggest that a stronger PEMF field like 150 millitesla may offer deeper, more stimulating effects on healing processes, especially when applied consistently over time. And that's an amazing finding. So in summary, we've covered the importance of red light therapy and the potential it holds for improving your health. take action. We hope that this webinar was helpful and inspired you to take action for your health, and then it's risk-free. We're offering you an efficient way to harness the power of red light therapy right in your home, risk-free. And if you would like that, if you want to know what devices specifically we've helped put into like places like the Hope for Cancer Center, treatment centers, and in the patient follow-up program, and all the doctors that are recommending, Dr. Daniel Pompa and Dr. Ed Group, and the long list of Dr. Henry Ely, Dr. Brian Artis' whole team, depending on Josh Axe, who I just mentioned. If you want to know about the devices that are being used by the world's top guys, then let's have that conversation if you like. So let me know whether you'd like to know about that, and we'll dive into that. And then we're going to go into questions. Just let me know here. Just getting some confirmation there. D says, he says, yes. I read that, yes, please, says Florence. I read that you must be careful not to put weight on the sauna blanket. So does this mean that you shouldn't use the top of you and not as a cocoon treating both sides of the body? No, you should be in it. And that's good. Absolutely. So no, it's kind of maybe more about like stacking lots of things on it, but the weight of your body is definitely, designed for that. So not a problem at all. And we have really great success with that. So remember, red light therapy is a non-invasive, cost-effective healing tool that can combat the rise in chronic disease. It's a transformative tool, can reduce inflammation, neutralize harmful free radicals, enhance your immune system, improve general well-being. So here's some things to look for. Oh, that's great. Julie says, yes, please. Tracy, yes. Catherine, yes, please. Thank you guys for engaging. I appreciate it. Cause I don't like just sitting here in an echo chamber. Otherwise I can actually see the waves outside of my door here. Cause I'm in Puerto Rico. I can, go surfing if you guys don't really want that. No worries. I'm happy to educate. Okay. So, Sue says, yes, please don't leave. Don't go surfing right now. No, I'm not going to go surfing. My boys really need me. Okay. Awesome. Yes. We're going to get through some of these amazing questions. Learn about your red light from the 2024 Healing for the Ages. Awesome. Yes. We love supporting those guys because it's such cutting edge information that we're all putting out together. Awesome. Marie says, really pleased with my red light belt I had from you so much. Thank you so much for your help. It's amazing that Marie, from such a low cost item, can have benefits that she can be praising for. Lorraine, yes, please. Looking forward to using all these modalities for healing cancer and other physical illnesses. Yeah, amazing. So neuropathy, yes, yeah, amazing for neuropathy. We've seen success in even mid-90-year-olds. And sometimes that's all you need to know. And then you say, which device? Well, any of them. And then you say, but how could it be any of them? Well, because they all are using red and infrared. And then it's just really then either like a cost thing, like, do you want a cheaper or more expensive? Like everything is going to be proportionate to the value. Oh yeah, I've got an invader. I thought I locked that door, but then I forgot to lock it on the way in. Great, you've got some tofu. Is it yummy? Good on you, man. Can you close that door, big guy? 4-year-old comes in with chewing down on some raw tofu. Good on him. Okay, so 9 wavelengths from 480 up to 1060. So this is all the panels. Dual chip, so meaning that you've got 2 different lights coming out of the same source. It's a 42 mil chip. It's 30-degree lens. These are all part of the reason why we get the deepest penetration that and highest irradiance, which is over 205 milliwatts, 195, depending on which panel I'll show you. But that anything around that 190 and even at 100 for a localized device is really strong, considering that you've got red light beds in clinics that people are purchasing from manufacturers for $150,000 and charging $250 a session that are at 50 milliwatts. Okay, so higher the delivery, the better. Like the thyroid studies, we didn't go through all the thyroid studies and all of that, but the 200 milliwatts in power equated to 96% of the participants having a remission of a large thyroid with Hashimoto's thyroiditis at near infrared wavelengths over the thyroid. And that was a 3-week treatment period. It was a 1-year follow-up. breakthrough study showing that you can actually, turn around and enlarge thyroid, goiters, etc. Normalization production of thyroid hormones. The study specifically with red light in combination with the supplements selenium, iron, and D3. And of those three, the two that are the biggest hitters would be selenium and D3. The therapy with the combination of with the red light, it was 70 times more effective. 70, not 17, not 70 times more effective at achieving thyroid hormone balance and 15 times greater at reducing medication needs. Okay. So, which arguably for a lot of people here, the thyroid condition would be most relevant, and it's arguably the biggest driver of weight gain. And if anyone's carrying more weight than they wish they were carrying, perhaps it's the number one thing to do is to correct the thyroid function, even if you're subclinical and you don't think that you've got an issue. So that, even like a red light belt, by the way, guys, over the thyroid, by the way, if you're doing this, you're either getting like your eyes down to your heart or your thyroid down to your stomach, or, to your, small and even large intestine, depending on your size. But that's almost going down to my belly button, right? From my thyroid down. Amazing. And then I can actually even put this strap around so I can sit it there and work. It's really something special. Okay. Mounting options, customizable touchscreen, like touchscreen LCD allows you to fully customize. You can take anything in and out, any wavelength. You can change any wavelength. Not that you would probably want to get this experimental, but you could, of the 9 different wavelengths, you could put each of them at like one at 90%, one at 2%, one at 50%. You have so much there. So if you ever learn something in the future, you have the ability to do it, even though the easiest thing to do is simply turn it on, use all the wavelengths and take out the blue for the evenings. And if you're looking at it, just take out the blue, which is a simple selection. Okay. So low EMFs, which is actually technically 0 EMFs. And I can show you that on a meter. I'll show that here in a second. I'll just put this on actually. So here's a meter there. I'm going to put this, and it's beeping because it's coming from the computer. And look at that. Wow. Huge signal there. I've got to come off, and I'm just getting an insane signal from the computer, which will then give me a baseline for what the reading is in this area. And notice that, okay, ready? It's still picking up a signal, but then when it's going over the panel, it's not pushing it higher because it's hitting these numbers already. So you've got a baseline. You've got to take the baseline for what's in the area. And then whether it's on or off, same thing, right? So it's completely off now. So there's your baseline that's in the area, and if I wasn't getting a signal in this area, you'll find that it reads a complete 0. And because it's a consistent light source, whenever you see it drop, and then if it stops picking up the signal, it'll go all the way down to 0. All right. See, you should see it going almost to 0 there. It's like it's picking up the Wi-Fi, because that's how I'm getting the internet to this computer for this, which I shouldn't even have the Wi-Fi on. I do have this place corded as well. But just for making sure that you guys don't have me patching in and out. But notice that, right? There you go, 0.2, which it'll go to a complete 0. So 0 EMFs, guys. And then just bring it anywhere out here. And then now we're getting way up there. Okay. So I won't keep boring you with that, but 0 EMFs. Flicker-free, high power, built for daily use, third-party tested, trusted by thousands of families and individuals around the world.